Welcome to Health Pulse, conversation with leaders who are shaping the future of healthcare and how we live as we age. I'm Drupal Patel, and today I joined by Pilar Carvajal, founder and CEO of Innovation Senior Living. Pilar, welcome to our show.
Thank you for
What?
having me.
Yeah, absolutely. So, what I really appreciate about Pilar's work is that it sits at the intersection of healthcare, housing, and dignity, especially for people who are often overlooked in the system. So, we will going to have a really good conversation. And Pilar, this will be a relaxed conversational, as I mentioned earlier, no scripts, no prep required. We'll be just explore your journey and ideas. So
Okay, sounds good.
great, great, great. I like that energy. So, Pilar, before we get into what you have built so far, where are you calling in from? And what's the energy of your day been so far?
Sure. So I am calling in from my headquarters in Winter Park, Florida. It's right outside of Orlando.
Wow, sunny and warm.
Yes.
Yeah, over here we are actually dealing with, snow and wind.
No, thank you.
Okay. So if we rewind a bit before innovation living, senior living, what were some of the early experience that shaped how you see healthcare and aging today?
Well, I think from my earliest beginnings, it was so I'm Cuban American, and both my parents left Cuba as a result of Fidel Castro, and we ultimately ended up in Sydney, Australia. And what I saw in Sydney that kind of created a really good foundation for me was a society that thinks about its community. So there was always this idea of it's we, not me, which is a very different way of thinking in the United States, which is all about me. And I think a lot
Right.
of our problems that we have today are related to this very individualistic, it's all about me kind of an idea. So I think that's kind of where my thinking started about it's all about the community and it's all about being kind to everyone in that community and potentially finding solutions for young, old, sick, all across the
Right.
gamut in terms of people.
Awesome. And you are dedicated so much of your career to serving seniors. Was there a moment, personal or would be professional, right, where this stopped being work and become a mission that, okay, it's not really a work, it's for mission for you.
Yeah, I think, well, I started my career as a management consultant. I was in New York
Hmm.
City when September 11th happened. And as a result, left New York City and moved to Miami, where my
Okay.
mother had just started a business in senior living. And it was quite a big change for me, but it was something that I was looking for in terms of having a real impact on people's lives. So I think the seed started there where I could see that my work could directly impact people's lives. And I think from there, just having served a lot of low income seniors, so people that need some level of support, subsidies in order to age well, that led me into thinking about another population of individuals that really had no financial support, no government program that could help them, like Medicaid. And then I started thinking about middle income seniors and how they
Mhm.
really didn't have an option in the United States other than being at home and many of them struggling because they can't afford what's out there. So a lot of senior living is very expensive and it's more for people that have, means. And then,
Mhm.
there's affordable housing and other supportive programs that are for people that are poor. But that person in the middle really struggles a lot. And I think that's where I really saw an opportunity where I could make the biggest impact.
Great. And what I'm hearing is a deep commitment, not just to a care, but
Mm,
to how care is delivered and in a way that preserves independence and dignity. And
yes.
that's what I like. Yes.
Very.
So now moving like transition to a little bit professional background. So you worked across consulting, you said operations, now entrepreneurship. Looking back, how did those experiences prepare you for leading innovation senior living?
Well, I think the experience in management consulting is a great way to start your career. It's actually what I'm recommending to my children as they get into college and look for careers because it gives you a real good view into businesses and how they work and how you can improve them and optimize them. As a consultant,
Right.
you're another set of eyes that is looking at a process that people are working on day to day, don't necessarily see where the areas for improvement are. So I think that set some good foundation for me. And then going and working with my mother in a family business and learning senior living, cutting my teeth and learning that business and how dedicated she was to this middle income senior, or rather to this low income senior, really in me created a desire to find my people, the people that I wanted to help and find a solution for. And it wasn't until I was accepted into a Goldman Sachs small business program that was really the catalyst for me to leave the family business and make the decision to grow a business that focused not just on low income seniors but on a middle
Mhm.
income senior population. And that's when I created Innovation Senior Living, the innovation being around finding solutions for this middle income older adult.
I have a follow-up question. So, since you mentioned about the leadership and the entrepreneurship, means that's really actually now it's, your kind of a core. So, what's leadership lesson you learned the hard way that now guides how you build and scale?
And I didn't necessarily see myself as an entrepreneur when I first became an entrepreneur because I had to
Hmm.
learn the business and I felt more like an employee learning the business. And then there was a point where things shifted and I really was moving the business forward, selling, finding improvements and so forth. But like every entrepreneur's journey, it's a roller coaster. Sometimes
Right.
it's up, sometimes it's down, and it is not for everybody. And I realize that I really love that and that I am somebody that thinks many steps ahead. So I don't sit on, my husband always says, I don't let the grass grow underneath my feet. I'm
Mm-hmm.
always moving forward. So if something doesn't work, I try it, I take my shot. If it doesn't work, I pivot and I try something else. And just I think the years of getting used to that and taking risks that for many women is very difficult. The way women are brought up many times is to be perfect, to not take risks. So I was
Right.
really having to do something that was very, I wouldn't say unnatural, but uncomfortable. And once I got comfortable with it, now I'm addicted to it. And I
Right.
really want to find other opportunities, partner with people, try new things to try and solve for the problems that I'm seeing as it relates to that middle income senior.
I like that perspective. It stood out to me. So,
Yeah.
and zooming out a bit, when you look at senior living or healthcare today, what do you think the system gets wrong about aging?
Well, there's a lot of ageism, unfortunately. Unlike my culture, where as people age, we value them. We see
Mhm.
such value in wisdom in aging.
Right.
Unfortunately, our country, there's a lot of bias against people and
Hmm.
aging. It's seen as a bad thing when we get better with age. We learn, we make our mistakes, we become better as we age. So I think that that's just something that we're going to have to constantly work against. Some of the concepts that I'm working on are fighting against ageism. There's going to be a real turn soon in our ability to live longer, better. And so we're going to be older for longer periods of time. And I think what you're seeing now is people are not retiring at 65, they're working
Right.
into their old age. I just read an article about Martha Stewart beginning her businesses when she was 50 and she's 80
Wow.
now and she's created $1 billion industry. Like, I think the eyes are opening for a lot of people that life can begin in your middle age and you can really have some big impacts on your life, on people's lives. And I think we need to
Mhm.
think about it in that way that we can really have a wonderful life, very impactful life if we want to.
Yeah, and thank you so much for sharing that insight. For someone hearing about innovation senior living for the first time, how do you describe what you are building and to whom it's really designed to serve?
Yeah, so it's Innovation Senior Living is an owner operator of senior living communities that serve middle income seniors. So we allow for individuals to pay privately and ultimately to spend down to qualify for Medicaid. We also have adult daycare programs within our communities. So we offer an affordable option through a day program. And then eventually we're going to develop a new concept that is a standalone new variation on the adult daycare program for middle income seniors. And that's what I've been focusing a lot of my attention on lately, called the Longevity Day Club, where we're going to create these very flexible, capital light service hubs where middle income seniors can come in and learn how they can live at home longer by doing things that are going to expand their health span, expand their. Right now, what happens is we have our lifespan, the numbers of years that we live, but our health span is shorter than our lifespan. That's why there's a senior living business, because those last 10 years, people are not living good lives because they're getting sick. So we're going to help people understand what they can do to expand their health span so that they can potentially put their lifespan and health span closer together and live at home where the middle income senior really wants to live, is at home. But if you live at home by yourself, isolated, ultimately the results are not very good. So it's going to be very community based as well. So I have a lot to talk about once we've got our pilot running and we've got some results, but that's been a lot of what I've been working on is a new service innovation for middle income seniors.
It sounds like a lot of good approaches and the path that you are taking to help not only low income, but the mid-level, seniors, mid-income level, right?
Yes,
So,
yeah, I can't stop thinking about it.
right. No, right. I'm really kind of curious to know more
Yeah,
as you build. But
sure.
so, what does the success look like for a senior or, say, example, a family after engaging with your model?
Well, the first move into senior living is always difficult. It's like going to
Hmm.
school for the first time, right? It's a new
Right.
environment, right? So you have
Hmm.
to transition in. And so we have programs for transitioning into senior living that make it more comfortable. So when you
Hmm.
go there, you know people. Part of why we do this adult daycare on the front end is to allow people to kind of try us on for size before committing fully. So I think once people understand what it is that we offer and they are able to create a community there. So instead of being at home by themselves, now they live in a building with other people and they make friends. That is what ultimately I think makes it very comfortable for someone that's just moving in. But ultimately, assisted living is 24-hour assistance
Hmm.
with what we call activities of daily living. So we basically are there to assist people with what they need help with and then enable them to remain independent in those things that they're independent in. And then we just grow in service level as people need services.
Right. Thank you so much. And when you think about scaling care affordably, what tends to become the hardest part to get right?
So, assisted living facilities are very expensive to operate. So, a lot of my experience when I was running affordable assisted livings, I have transitioned into middle income operations. So, it's
Hmm.
similar to my industry does a lot of the Ritz-Carlton type product, and there's a service line for the Ritz-Carlton. I'm
Hmm.
running Courtyard Marriotts if you want to make a direct correlation. So there's a level of service that works. And so it's many years of experience determining exactly what is the service line for a middle income product and then building the infrastructure around it, be it people,
Right.
technology, different products that we bring in, vendors that we work with. So it's a service model that obviously I've been working many years to perfect.
Right. And I know since you have multiple communities and that you built so far, what are some of the behind the scene challenges operator faces that most people don't see, but that impacts a lot or everything?
Well, I think with challenges like COVID, those were very alarming type challenges that we were able
Hmm.
to overcome. I think staffing challenges are
Hmm.
always present. And I think that that's present for anybody that's in business. Staffing is always the most difficult of any business. And we hire a lot of staff from the top manager all the way down to the housekeeper. So we're very complex operations. I'm running
Hmm.
restaurants, I'm running housekeeping, I'm running clinical services, I'm
Hmm.
maintaining buildings. It's a lot that goes on in one senior living community, in addition to all the activities and programming that has to be in place that keep our residents engaged and entertained. So they are not for the faint of heart operationally. So I would say there's a lot that goes into running senior living communities that I don't think everyone understands unless you're in my seat or in my staff seat day to day.
Yeah, no, I completely understand. I think I'm envisioning, I mean, as you mentioned, different stuff that, it comes with. Do you want to highlight one of those, like you think feel more complex or say more manual work than you would think? Any of that area
I
and
think
whether,
what people don't necessarily always think about in our operations is we're 24/7. We do not
right?
close. Okay. And that's one of the
Hmm.
complexities. When I relate back to staffing, we have to make sure that our buildings are open 24/7, 24 hours, 7 days a week without fail. And so
Right.
that is a difficult thing to do, to maintain a
Definitely.
high level of service all the time. So I think that that's just an interesting concept, I guess.
This would be an interesting question because let me ask this one first.
Mhm.
So, if we were having this conversation a year from now, what would make you feel that this chapter really moved the needle?
So for me, in a year's time, I definitely want to have my concept, my new concept firmly in place and
Hmm.
really start moving that idea and maybe building more on that than any other thing that I've done in the past. So the growth of my senior living portfolio is always going to be there, but where I see there's going to be massive growth is going to be in this new concept that's really not going to be heavily reliant on real estate. So when you're
Hmm.
not reliant on real estate, you can expand it much quicker. So I think in a year's time, we're really going to start seeing that trajectory of growth really
Hmm.
start put itself into place.
And thank you so much for sharing that. I think I have one follow-up question where what would you love to see become a true at scale? Like for the people you serve or the model itself, the one that you just talked about?
It'll be both. The model
Right.
will scale and we will be able to serve thousands and thousands of individuals that right now have no options. So that's, I mean, it's something that is driving me, something that I have to see get done. It's, I don't know what it is. It's
Hmm.
this passion or it's this desire or need that I have. I don't know why, but I need to see this happen. And I feel that I've been spending many years looking at what's going on in my
Hmm.
industry or not going on in my industry and many others that are related. And now I'm able to kind of piece everything together to solve the problem. So I have the solution. Now I have to bring it to market. And that's really exciting.
Right, right. And if there is one thing that it could dramatically accelerate your ability to serve middle income seniors, what would it be?
Money, investment, right?
Right. I mean, is that the key part?
Investment in the concept, because investment in the
Correct.
concept will be the fuel that
Hmm.
allows it to grow. So the idea now is to really
Hmm.
have the pilot, prove the concept, get the investment, and then go crazy.
Other than like money part, do you think that you need to work on more on your model, or I think that it's kind of you did so far, or you have this money experience, this much years of experience. I think you are kind of pretty confident that it is going to work.
Yes, I have no doubt that
Right.
it will work because one, I have been talking to many people about the concept, and everybody says, for the most part, it's a very sound idea. I think the fact that my industry experience leads me here, everybody sees that as well, and it just
Right.
makes sense. So I think it's really a personal to decision, like I think it is with any entrepreneur, right? Do I go
Right.
and do it, or do I just sit back and not do anything? Well, unfortunately, I can't sit back. I have to
Right.
move it forward, and I will.
It sounds like it's time to take action, not to
That's
just
right.
sit back. It
Yeah.
need to act, right? So
Yes. Action is the key word.
exactly. So no,
But
this
I
is
would
this is
say,
amazing.
just to add to that point, just thinking about your question, like
Hmm.
I cannot do this by myself.
Okay.
So the key is, and I joke when I say money, but the key is really going to be about finding the people, my employees are going to help me make this happen. And so I think that at the end of the day, the idea is sound, but the impact that it has or will
Hmm.
have is very compelling for many people. They understand the problem and they see this as a potential solution. I think that that's going to help me bring on some great people to help me expand this and make it a success. It's my idea, but I need great people to help me move it forward.
Right. It sounds more not only just the funding, but it's a teamwork
100%.
and the defined process or the
Yes.
solutions. So where can people learn more about your work or follow what you are building next? Is there a way
Yeah,
that
I
the
think
people can connect you?
absolutely. I think the best place is LinkedIn. So you can look me up, Pilar Carvajal. You can also look up my company or my new concept, Longevity Day Club. That company is now on LinkedIn, and they have websites. So I'll be keeping all of that updated. But I think that'd be the best way. And please connect with me. I'd love to get to know anyone that's interested in any of these concepts. And I'm always happy to talk about how to partner in order to make these concepts move forward.
Awesome. Pilar, I really appreciate the thoughtfulness you bring to this space, not just building something scalable, but something humanate. So I really appreciate, and thank you so much for sharing your journey with us on Health Pulse. It sounds really amazing.
Yeah, it's been my
Uh,
pleasure. Thank you for the invitation.
yeah, thank you so much again for your
Okay.
time,
You
and
bet.
I really enjoyed it.
You bet. Well, thank
Yep.
you. All
Thank
right.
you. Thank you, Pilar.
You bet.
Bye-bye.
Bye.
Bye-bye.